Well, good morning, Jaginder Rana here. I'll discuss today perilous state of health insurance in India. Perilous state of health insurance in India. Indian economy is undergoing a transformation, fueled by the rise of the gig economy. Unlike traditional employment models, this new landscape offers individual greater flexibility and control over the work schedules. So, from driving app-based taxis to delivering groceries, millions of Indians are embracing the gig life. As per Niti Aayog, almost 25 million Indians will be part of the gig workforce by 2030, a substantial portion of the total employed population. So while the gig economy provides opportunities for many, it also presents a unique set of challenges. Because these gig workers, by the nature of their work arrangements, often lack the social security benefits that come with traditional employment. One of the most concerning issues is the lack of access to health care or healthcare insurance. So, unlike salaried employees who receive employer sponsored health insurance plans, gig workers are left to fend for themselves. Only 1 in 5 gig workers have life or health insurance coverage. And from those that are covered, it is highly probable that they are not sufficiently covered. This exposes them to significant financial risk, as even medical emergencies even minor medical emergencies can lead to substantial out-of-pocket expenses. So furthermore, a large portion of total healthcare spending comes from out-of-pocket expenditure. The total out-of-pocket expenditure in the country is almost touching 50%. For gig workers whose income can be variable and often project-based, a sudden medical expense can be financially devastating. So the lack of health insurance for gig workers goes beyond the immediate financial strain. The fear of medical bills can deter them from seeking timely medical attention. This can lead to a delayed diagnosis and treatment, potentially worsening health conditions and impacting their ability to work. Furthermore, the stress and anxiety associated with the potential medical bills can negatively affect their productivity and overall well-being. While the current state of health insurance for gig workers presents a significant challenge, there are positive developments on the horizon. Some progressive companies are taking the initiatives by offering health insurance plans for their drivers, delivery partners, and other gig workers. These plans, while varying in scope and coverage, typically offer some level of financial protection for emergencies, hospitalization, and daycare procedures. So, furthermore, some state governments are recognizing the need of action. The recent announcement of a health insurance program for gig workers in Karnataka, offering coverage for accidents and hospitalization, is a step in the right direction. So these initiatives demonstrate a growing awareness of the challenges faced by gig workers and a commitment to providing them with a degree of security. While these developments are encouraging, there is still a significant distance to cover. Ensuring wider coverage across the diverse landscape of the gig economy presents a major challenge. The wider coverage nature of the gig worker workforce makes it difficult to reach all workers and ensure consistent enrollment in health insurance plans. So another critical issue is the standardization of benefits. There's a lack of uniformity in health insurance plans offered by different companies or government programs. So the inconsistency can create confusion and limit the effectiveness of these initiatives. Establishing minimum standard for coverage would be crucial in ensuring that gig workers receive adequate protection. The collaborative approach is required because the government can play a critical role in mandating health insurance coverage for gig workers. They can develop and facilitate efficient enrollment processes to ensure inclusivity. A central insurance scheme for these workers can also be a catalyst to drive adoption and could have designed affordable yet comprehensive health insurance plans specifically tailored for the needs of these workforce. Startups and platform companies that rely heavily on gig workers have a vested interest in their well-being. They can contribute by offering subsidized health insurance plans or partnering with insurance companies to develop bespoke coverage options for their workers. Insurance companies can play a crucial role by designing innovative and affordable health insurance products especially catered to the gig workforce. These plans should be flexible and adaptable, allowing for variable income and offering coverage options that are easily scalable based on specific needs. Industry associations and advocacy groups can play a vital role in raising awareness about the importance of health insurance for these workers. Additionally, such bodies can launch their own insurance programs for certain categories of workers to subscribe to. Looking at this holistic approach, encompassing mandatory coverage, standardized benefits, and collaborative efforts across stakeholders, and ongoing innovations will be key to bridging the health insurance gap for India's gig workers. As the gig economy continues to evolve, ensuring access to quality health care will be essential for fostering a thriving and secure work environment for this increasingly critical segment of the Indian workforce. India has a population of 136.64 crore people. So currently it is the second most populous country in the world, but is expected to surpass Chinese figures soon, or it has already crossed. So health is an important factor of any successful economy. India has come a long way in terms of medical technologies, but with such advancements, medical costs are also rising. So it is important to buy health insurance to cope with the rising cost. However, the sad part is health insurance penetration in the country is still minuscule. Millions of people end up spending significant earnings on healthcare services, which makes their financial situations more difficult. Most of the population comprise people less than 35 years of age. So 50% of the people are below the age of 25 years, and the average life expectancy of an Indian is 70.03 years. Health is a major factor that affects the economy of densely populated countries like India. It is safe to say that the GDP of the country depends on how healthy the population is. So India has a large chunk of working professionals that keep the wheel of the economy turning smoothly. In 2020, India had approximately 501 million workers. So the poor state of the healthcare system and lack of awareness about health insurance plans in low-lying areas force people to spend heavily on healthcare. Health insurance penetration in India is extremely low due to limited reach and lack of awareness and education. This consequent burden is borne by people themselves. Around 75% of Indians pay for medical services from their pocket. They are not covered by any government or private health insurance schemes. So, a factor to increase penetration is foreign direct investment. It can help improve insurance awareness and reach in the country. The recent hike in FDI from 49% to 74% in the insurance sector can propel the health insurance industry in this direction. India is majorly reliant on the private healthcare system to cater to the medical needs of people. So 58% of hospitals in the country are privately owned and 81% of doctors serves at these hospitals. This leaves a narrow space for people who cannot afford to avail of medical services in a private hospital. As per the National Family Health Survey 3, 70% of urban and 63% of rural households depend upon private hospitals where the cost of healthcare services are usually much higher than the government-owned medical facilities. Thus, middle and upper class individuals are more likely to avail of services in a private hospital. Major part of the population had limited access to quality medical services, and healthcare professionals like doctors, specialists, nurses, etc. Around 74% of India's medical professionals are serving a mere 28% of the population. So low funding is another factor that results in a lack of medical infrastructure in the rural areas. Privatization is so prominent in the healthcare sector that only 1/5 of healthcare is financed publicly. According to a study conducted by National Health Accounts, the total out-of-pocket expenses on healthcare stood at 58.7% in 2016-17. As per the Public Health Foundation of India report, 55 million people were drawn to the poverty in 2017, and now the latest data is also showing almost the similar details because there is no rise in this detail except a little. So some challenges faced by people who don't have health insurance coverage is bearing the expenses related to hospitalization, cost of ancillary services like ambulance charges, diagnostic tests, no value-added services like free health checkup, telemedicines, free fitness, monitoring apps, etc., and no renewal or other loyalty discounts. So these challenges increase out-of-pocket expenses. The cost increase multifold when the family contains children and elderly people. Health insurance is a solution to such challenges. One can claim costs like hospitalization expenses, ancillary services, value-added services, and get discount on health insurance policies. So the financial burden is greatly reduced when a good health insurance company is providing the backup. Thank you very much.